Well, the bill isn't everything that I had hoped for. I was hoping for a public option to give people a choice as per their current private insurance. But there are many powerful things about this legislation that are going to be very helpful to Wisconsin. Senior citizens are going to be able to have that donut hole under their Medicare Part D covered so that they have a better deal on their medications. And for Wisconsin, we have a tremendous change in the geographic unfairness of Medicare reimbursement. We've been ripped off on this thing since 1980. And finally, we're getting real change that will help our doctors and our seniors get a better deal on that reimbursement. And when it comes to making sure that poorer people have health care, Wisconsin's had the vision to get ahead of that issue. We wanted to make sure that we wouldn't be punished for doing the right thing, and we did achieve that. So in terms of the fiscal benefit to our state, it's a big deal, and I think it may be very positive for not only health care in Wisconsin, but also for our fiscal situation. Well, it was divided almost down the middle. Over the years of 17 years of my town meetings, people have been demanding greater coverage, in fact, universal coverage for all Americans. This year there was a great division on this. It was about 50-50 when it ended, but I found that, generally speaking, people were much more positive about the public option than they were about the idea of doing absolutely nothing. So I think we've come up with a bill that moves us in the right direction, and my hope is that in the future we're able to add a public option to the bill, either through this bill, through the conference committee, or in coming years. Well, the bill makes a big difference in terms of Medicare reimbursement. We currently have a situation where we were punished as a state, and other states were too, because we provided better quality health care for less cost. We got punished for that under a formula that benefited states like New York and Florida. We've made a huge change in that formula. And that's something that people that really know something about health care in Wisconsin have been asking for years. So that is a major victory. I'm going to vote for the bill in the Senate with the hope that when we either have a conference committee or negotiations, that a public option is placed in the bill. And I also am going to vote for it because it is very good for Wisconsin's fiscal situation, and it's going to provide health care for 30 million Americans who don't have it right now. I happen to have health care for me and my family. And in good conscience, I can't vote against extending it to all these people that don't have it right now.